Hello, my name is Arya Goel, and I will be discussing how the social determinants of health impact generational cardiovascular disease and how we can take steps to break the cycle. First off, a little bit about me. I am a senior at Carmel High School, which is based in Indiana, and I am very passionate about global and public health. I founded a student-run news source to spread awareness about global health topics called the Global Health Inquirer, and published a book teaching students about health equity and community-based medical interventions. I serve as president of my school's HOSA chapter and have engaged in over 250 hours of clinical public health research at Indiana University Health, which I'll be discussing today. Additionally, I hope to major in either global or public health. First off, what is cardiovascular disease and why is it taking so many lives? Cardiovascular disease relates to the group of disorders that affect the heart and blood vessels. These complications can vary from coronary artery disease to stroke to heart failure to a variety of other conditions. Globally, cardiovascular disease is the leading cause of death, disproportionately impacting vulnerable low to middle income communities. While individual risk factors and lifestyle choices contribute to the high rates of disease shown by these statistics, there remains a significant gap in research addressing the role of social determinants of health. Even though the National Library of Medicine estimates that they account for up to 55% of health outcomes. But what are these social determinants of health, and why are they so influential? Social determinants of health are the conditions in which people live, work, learn, and interact, factors that shape daily life and access to resources. The 5 major social determinants of health are education access and quality, healthcare quality, neighborhood and built environment, social and community context, and economic stability. My ongoing clinical research internship at IU Health uses survey questionnaires to analyze 3 generations of families, and initial data has shown that these social determinants of health don't just affect individual outcomes, but can actually shape generational cardiovascular disease risk. Though my current research is still compiling results, initial observations suggest that social determinants influence every aspect of an individual's health. For example, insufficient education contributes to lower paying jobs and less insurance. Discrimination and lack of support increases stress. Practices such as neighborhood segregation limit safe housing, green spaces, and healthy food. Poverty reduces education, preventative care, and stable jobs, raising hypertension and diabetes risk. And food deserts lead to high-fat diets that increase obesity. Together, these factors affect individual health and community well-being. While these may seem like background details, they actually play a frontline role in determining who develops chronic diseases and who doesn't. These risk factors accumulate, and unless we intervene, they can be passed from one generation to the next. But let's go a little bit deeper. How can we explain the impacts of these determinants biologically? Chronic stress from poverty, discrimination, or unsafe living conditions activates the body's fight or flight response, releasing stress hormones like cortisol, which increases inflammation, blood pressure, and diabetes risk, key contributors to cardiovascular disease. Research shows that people with high stress levels have larger blood samples of inflammatory molecules called cytokines, such as IL-6, TNF-alpha. Studies have shown that psychological stressors like childhood adversity and discrimination directly correlate with inflammatory biomarkers and can double the risk of cardiovascular disease in adulthood. Imaging studies have found that stress corresponds to increased bone marrow and spleen activity, indicating an activated immune response. This promotes stem cell growth, which can increase risk of heart disease. This shows how social adversity rewires the immune system, increasing long-term disease impacts. The effects of the social determinants of health extend to cellular aging. Personal and economic instabilities cause DNA changes, like altered gene patterns and shortened telomeres, the protective cap on chromosomes. Shortened telomeres are linked to early aging, hypertension, heart disease, and premature death. In fact, newborns from low-income or unstable families already have shorter telomeres at birth, suggesting stress and disadvantage can impact health before life even begins, with social stress impacting mothers during pregnancy and ensuring generational harms. Cardiovascular disease affects over 500 million people worldwide and causes 1/3 of all deaths. More than 80% of early cardiovascular deaths happen in low and middle income countries, where social and economic challenges limit prevention and care. For example, in many areas, fewer than 50% of adults with hypertension know that they have it, and even fewer get effective treatment. Social factors like limited education, food insecurity, and poor living conditions contribute to these gaps. To fight this cycle globally, we must address these social inequalities and strengthen health systems to reach vulnerable populations. Otherwise, low-income communities and developing countries will be stuck in a spiral of poor health outcomes and widening disparities. Addressing the cycle requires action across multiple levels. Through streamlined focus groups, my research team seeks to improve social determinants from the perspective of healthcare workers. Clinically, providers should be trained to screen for these factors and adapt care to meet patients' external needs. Equipping healthcare workers with the tools to recognize and respond to these influences is essential. At the community level, expanding health work programs, improving housing, increasing access to green spaces, and investing in education and maternal-child health can create healthier environments. Policy efforts must also integrate social determinants into cardiovascular risk models and update clinical guidelines to reflect those broader influences. Programs such as the World Health Organization's Global Hearts Initiative or the Community Health Initiative demonstrates the success of culturally tailored, community-based interventions in improving cardiovascular outcomes. The message is clear. Cardiovascular disease is as much a social condition as a medical one. The effects of poverty, discrimination, and chronic stress are written into our immune systems, DNA, and our arteries. To effectively reduce cardiovascular disease, we must address these social, structural, and environmental root causes. Through research, education, and community action, we can transform awareness into impact and move toward a future where health equity is a reality. These are the references I cited throughout the presentation. Thank you so much for listening. I appreciate the Johns Hopkins Global Health Leaders Conference team, as well as my research mentors at IU Health. If you have any questions or would like to reach out and connect, you can contact me via email or LinkedIn. Thank you so much and have a great day.